Hi, everyone. Thanks so much for joining us. We're going to get started here. My name is Matthew Montesano from the Department of Health. Um, and as you heard, I'm here with my colleagues, Hillary, Clarissa, and Martha. And before we get going, I want to give you all a little bit of a rundown on what you can expect over the course of the next hour or so. So we're going to give you a rundown on the data that the health department makes available for you to use. And this is going to include our open data resources, and then these other data communications products that we develop for people like you to use. And these include Epiquery, Community Health Profiles, the Environment and Health Data Portal, and COVID-19 data resources. So just to sort of frame how we're going to be talking about data a little bit, we want to share some of our perspective about the health data that we're going to walk you through. These data are stories. We don't always think about data as being totally objective fact, but rather about something that sheds light on what's happening in our city and a reflection of the world around us and how we perceive it, right? So any given data point is sort of an outcome of the process that produces that data point. And with this process, we create knowledge. Inside a government agency, we're using all of this public data. Our analysts and epidemiologists are hard at work working with these public data sets to turn information into knowledge. And it's an important part of our job to share that knowledge as well as we can, to make tools that other people can use to continue to improve the city and improve the health of New Yorkers. And so with that in mind, we're glad that you all are here. Within the Department of Health, we work with an incredible breadth of data, lots of different types of data. And this includes surveys that the health department does, surveys that other organizations do, like we work with housing and vacancy surveys and census data and the American Community Survey. Our data also includes a type of data called surveillance data, which is sort of a strange word that we're used to. Other people may not be. But usually this refers to disease registries and hospital reports, things that are sort of reported into the public health data stream that we get access to. And it also includes data like vital statistics data, data on births and deaths in the city, and then a really significant volume of data about the things that the health department does, operations, right? Like inspections, restaurant inspections, rat inspections, and other administrative data. So we're really working with, like I said, an incredible breadth of data. And with that in mind, we also have a great breadth of data products, different ways that we offer access and explanation to all this different data that's produced by, generated by different areas in the health department. So we want to make you all sort of capable of understanding a little bit about sort of all of this stuff. So we're glad that you all are joining us here today. With that, I'm going to throw the ball over to Martha to take it away.
Thanks, Matthew. So I always start by saying that working to call out inequities is a really big part of our work. And I think as it's our obligation as people who work in public service. I'm always guided by the words of our former health commissioner, Dr. Mary Bassett, who said that inequities in health are unfair, unnecessary, and avoidable. And that a more deliberate effort to name and address them will frame all that we do. So we really try to do that, to try to frame our work with that. Because structural and institutional racism has persisted throughout our city's history, and we still see the impacts today on health, on socioeconomic conditions, and also in one example of how we see that is in life expectancy. Life expectancy is a good catch-all measure to compare overall health from neighborhood to neighborhood because it encompasses things like premature mortality or dying before the age of 65, disease, and poverty. So this map shows life expectancy in New York City by community district. If you are familiar with the community board in your neighborhood, that's using the same geography as community district. And just a side note that a lot of the tools and data we'll look at today use different neighborhoods, different geographies, like different definitions of neighborhood. And there are many of them. There's a great data story on the Environment and Health Data Portal that we can show you the link to that explains some of the geographies. But the main takeaway is just be sure when you're looking at data, if you're comparing two different kinds of data, be sure you know what geography it is, how they define the neighborhood. In any case, these are community districts, and we can see that the lowest life expectancies are the neighborhoods in the darkest colors, and the highest life expectancies are the neighborhoods in the lightest colors. This really lets us see how neighborhoods are segregated by race and wealth. If you've seen maps of historical redlining or other policies like that, this lines up a lot with those in terms of health outcomes. But we're really lucky to have robust local data like this that can be used in so many ways. And to tell you more about some of our data, I'm going to introduce you to our colleague, Clarissa Solis, who will tell us about the health department data that are on open data.
Thank you, Martha. So hi, I'm Clarissa, the Open Data Coordinator here. I'm excited to talk to you guys about open data. So you are likely all familiar with open data or are learning about it this week. So open data, Local Law 11 went into effect February of 2012. The law requires all city agencies to make their public data available online through the online open data portal. And so I put the Local Law 11 here. Essentially, there's public data found on any platform, such as the Community Health Profile, Epicleary, and the Environmental Portal. It must be available publicly on that New York City Open Data site. And of course, this is the goal that we're working towards with our model data sets that DOH emerged. So prior to and leading up to this law, DOH have already been making health data accessible to the public through the Environmental Health Portal, Community Health Profile, Epicleary, our various publications, including our Vital Signs, City Health Information, and of course, through the media. Also, data can be found on our own DOH website. And for a bit more background, since 2010s, the health department, things were added by the health department, for providing health information to our constituents. So some of these tools will be discussed today, and I'm used to make or tell the story behind the data available. So the data provided in the system and publications are derived from the department's underlying data assets, many of which are protected under privacy, security. Oh, we can go back. Sorry about that. Security and our HIPAA protections. Open Data provides New York City with a single portal to streamline constituent access to intergovernmental data. So that, of course, includes the health department. And so, though the story behind the health data is not contained on open data is what provides the underlying data without risk of data privacy and confidentiality, which then enables you, the constituent, to access and analyze the data for yourself, perhaps to promote innovative strategies for your work or our city. And so complying with open data requires agency coordination and communications. So remember, the health department is a very large agency with approximately 7,000 employees. So most department data assets are managed by the individual data team and their data stewards. So me, the open data coordinator, seen in the center there, I work with the divisions or bureau liaisons, usually one from each health division, who in turn work with the data stewards. So here we see data from our Center for Health Equity and Community Wellness, Family and Child Health, Environmental Health, Disease Control, and the Center for Population Health Data Science. These are just a handful of the many divisions here at DOHMH, and within are a few examples of data sets within each division available on the New York City Open Data site. To maintain DOHMH data on open data, I regularly review the department's data assets with division and data steward representatives to determine whether the data asset, in total or in part, can be made accessible to the public, given department resources and data confidentiality policy, of course. If so, then data steward prepare the data along with our open data standard file layouts and data descriptions that can be posted. Some data is updated annually, others with more frequency, such as daily, weekly, monthly, and so on. In addition to the data stewards, I also work with the health department, freedom of information officer, privacy officer, and the communications officer. Outside of DOHMH, of course, I frequently work with the Office of Technology and Innovation.
So for some interesting information, among our 80 plus health department posted data sets, the 5 most frequently accessed are the New York City leading causes of death, New York City restaurant inspection results, COVID-19 daily counts of cases, hospitalizations, and deaths, air quality, and New York City popular baby names. And here are some few data sets that have been recently released and or updated for their annual updates. So we've got cooling tower data registrations, senior adult daycare / senior center inspections, percent of live births by infant sex and mother's race and ethnicity, DOHMH HIV/AIDS annual report. And of course, there are so many more on the open data site, and I would definitely encourage you to take a look, as there are many different interesting ones. And we can go next. And here's what's coming soon to the open data site. So the agency is expecting the following data sets to be released by the end of this year. So we've got honeybee apiary registrations, supermarket discounts, working horse licensing, and multiple mobile food data sets, such as commissary inspections, vending inspections, and waiting lists.
Oh, Clarissa, there's a question. What is supermarket discounts?
Yeah, so that is going to be a list of supermarkets that provide dollar for dollar match on supplemental nutrition assistance program for SNAP, purchases of things like eligible fruits, vegetables, and beans through the Get the Good Stuff program. And so these matching funds can be used to purchase more eligible fruits, vegetables, beans, etc.
And there's another comment that the mobile data sets will be very useful.
I agree.
Yeah. Oh, sorry. There's one more question. Will the vending inspections include frequency of inspection?
Yeah, so it will include frequency. It will include the dates that the inspections happen. Those usually happen daily, so that is inputted by the inspector themselves, and it updates overnight.
All right. Well, I will start the section of our tour that includes the data on our website. So if you go to nyc.gov/health/data, this is where you will find the rest of the data that you'll see during the tour today. I have a few slides to walk through, and then I will get on Chrome and just walk through the two data tools that I'll show you. But if you start at nyc.gov/health/data, we have a data tab where we sort of consolidated everything, and you have three choices: interact and visualize, data sets, and publications. First, I'll mention publications. We have a variety of series and special reports. Many of them have a health equity focus. They're all by health department authors. Some are annual reports that I know people look forward to every year, like a summary of deaths by drug overdose, the vital statistics, which has birth and death data, reports on specific diseases like hepatitis, HIV, and then we have some special reports as well. The most recent one being the health of Asian and Pacific Islanders in New York City that was able to disaggregate data by Asian ancestry and show health outcomes by that. Another section of the data tab is data sets. So if you are an analyst or if you want to refer an analyst on your team to this tool, we have a data catalog on that portion of the website that lists the publicly available health department data resources. And then this is where to look also if you want documentation on a certain survey. So if you have a question like what was the exact question asked in the survey script, you can find that documentation here. Then the Interact and Visualize tab is where you can find links to our main data tools, including EpiQuery, the Community Health Profiles, Environment and Health Data Portal, and COVID-19 data. We're going to talk about all of those today. I'll tell you about EpiQuery and the Community Health Profiles. And then Matthew will tell you about the Environment and Health Data Portal, and Hillary will go over the COVID-19 data. So, in the EpiQuery and Community Health Profiles, we have a little error that pops up. It says some map details are not available. All you need to do is click the X and it will go away. So EpiQuery, there's a short link, nyc.gov/health/EpiQuery. And this is where you can go to get really an analysis, look at trends over time, look at survey data, vital statistics data, disease surveillance. You can filter and disaggregate by neighborhood, by many characteristics. And so I will demonstrate that for you in just a moment. And then the community health profiles, there's one profile for each of New York City's 59 community districts, covering a variety of neighborhood health topics, including maternal and child health, social, economic conditions, everything you see here. And the real beauty of the online community health profiles tool is that you can compare neighborhoods. You can add a comparison neighborhood. You can, and then see the most favorable rates for any particular indicator that you're looking at. In any of these tools, you can download, share, or print the data. And these are the icons that are used in EpiQuery, and the profiles, they might look a little different in the other tools, but this is what to look for. Great. All right. So you can navigate to this from the health department homepage, or you can go to nyc.gov/health/EpiQuery. And I think the main advantage of EpiQuery is you're able to see a lot of our survey data and disease surveillance data, and really look at it and filter it by different characteristics. So you can search indicators in the top search bar. You can look by topic as we scroll down a bit. You can search by source, so if you know which survey, and then you can search again indicators with this link at the bottom. So let's say if we want to look at community health survey data about anything, I'm going to click on the community health survey, and we'll be able to look at a broad range of health conditions. Let's see. When you click on a survey, you'll get to this data choropleth map where you see the data points over time. This will show the 6 most recent years of data that are available. Again, at the top, you'll see the title of the data source you're looking at, and then the indicators are listed on the bottom left. So let's look at, just for example, blood pressure medication current. So to move past this screen, you'll just click on any data point. I'm going to click on yes for blood pressure medication. I'll show you what all you can do with this. Most of the module pages within EpiQuery will have these blue bars across the top that just show different elements of the menu, what you can do. So we have the item we're looking at, blood pressure medication. How do we define it? That's basically how was it asked on the survey. And then this overall prevalence for blood pressure medication coming up in the 2018 survey. So we see that the overall yes was about 75%, and no was 25%. Then we have the trend over time. And I wanted to clarify, this is restricted to adults who were told by a health professional that they had blood pressure and were told to take medication. It was just a little frightening to think that 75% of adults were on high blood pressure medication, but this is why we read all of the fine print. So if you were told by a health professional that you should take blood pressure medication, how many of those folks were taking blood pressure medication? About 75%. It looks like the trend shows us about the same over time from 2005 to 2018. Scrolling down a bit, there's a demographic overview, and this is sometimes where you'll start to see differences. So we have it by sex, by race and ethnicity, by age group, and by borough, and this can be very interesting to look at. We can also analyze by neighborhood as we click through these blue bars here, analyze by demographics. You can compare 2 indicators, and then you can test the statistical significance of the difference. So just to make sure you're seeing all the navigational features, these blue bars across the top get to a different feature. Again, there's the little map error. The gray box at the side, you can click to a different indicator or different year. Under this neighborhood, you can look at a map, a bar chart, or a table. Sometimes it can be very useful to look at the table to see confidence intervals. And then at the top, you can switch to a different data source if you would like. So EpiQuery really has a very robust set of data, and you can do a lot with it, which I think is a lot of fun. Oftentimes students will ask to look at it by demographics. And so on this page, you can look at group it by borough, education, poverty, just for example, and then filter to one of those. So it's going to be a very useful feature. What is the smallest geography that the data are available at? So right now in EpiQuery, we use United Hospital Fund neighborhood. We are working to get estimates for community district, but those will be 2 years of pooled data. But as I said, each of our data tools, and sometimes by source, even the geographies are different. All right, so I just want to show you one more thing of how this might look. If we look at, say, age group and education. So this can be interesting to see just the whole sort of breakdown by education and age group, then the prevalence of adults who are currently taking blood pressure medication. And we see a few features here, rather. if there's a hashtag, you can look at the bottom, data are suppressed due to imprecise and unreliable estimates. And then if there's an asterisk, again, that's a note at the bottom. So you would always want to look to the bottom and see what if there are any particular notes. Michaela, I see you have a question. Is there a stigma of taking medication for blood pressure? I don't know. And that's something that looking at this, you might see a difference in of some certain population taking it or not taking it. And we really can't assume anything just from looking at the numbers, right? This is just a survey. So you might want to do more research on that to see if there's anyone has done sort of a study of that to see if there's any particular reasons why people would or would not take blood pressure medication. I want to show you one more thing before I turn it back over to Matthew and Hillary. The community health profiles are, let's see, nyc.gov/health/profiles. And to enter the profiles, you'll just start by looking at a community district. So there's a map that comes up. The map is not coming up. But you choose a neighborhood on the map, choose a community district. There are 3 ways to choose a community district, rather. I like to just pick from a list. So if we look at, say, Greenpoint and Brooklyn, and then you can enter the profiles by choosing a topic. If there's a little plus sign, you can expand it. So the plus sign there, you can just go to a different, oops. All right, the profiles are being fidgety this morning. Maybe we can come back to those. But the best thing about the profiles, I think, is, as I said, you can look at one neighborhood, then add in a comparison neighborhood. There are a lot of data visualizations and explanations. They're a really good place to start if you are not comfortable with data, but you want to learn more about your neighborhood and have that data to work with students or to advocate for people in your neighborhood or talk to anyone about it. So I will stop sharing this and share the slides again so that Matthew can tell us about the Environment and Health Data Portal.
I'm going to share with you all the Environment and Health Data Portal, which is one of the agency's data communications products. I'm going to chat the URL here for you all to explore on your own if you'd like. But just a quick check, is my screen coming through for you all?
Yeah.
Great,
Yes.
Thanks. So the Environment and Health Data Portal includes data for New York City neighborhoods about environmental health. And what is environmental health? Well, it's, or rather, what's the environment? The environment is chemicals in the air, ground, and water, sure, but it's also the rest of the world around us. And that includes the built environment, so things like housing, streets, parks, and it also includes the social, political, and economic environment. So basically, this is everything in the world around us that affects our health, that sort of determines what we're exposed to that can put us at risk, or what resources we have access to that can protect our health. And this tool is part of our agency's work on what's called environmental surveillance and policy. So understanding how the environment affects our health and working to improve it. So here is the site, and I want to tell you a few key components about this. So first of all, this isn't an exhaustive library of data or data sets, but rather it's a sort of curated collection of data that we consider meaningful that describes these environmental health topics. And this includes both data from the health department as well as data from other sources. So we pull data from other areas, from the Open Data Portal and from other data sources like the Census or the American Community Survey or other city agencies in order to pull things together so that we're illustrating these topics in a well-rounded way so that we can show connections between environments and health. We try and start to offer answers to the question, why is something the way it is, by showing the things that are connected. All right, so with that as a brief introduction, I'm going to take you in and I'm going to show you around different areas of the site. So I'm going to start over here with the Data Explorer. And the Data Explorer is where you can browse all of the data sets that are on the site. So just briefly, if we look down this list of topics, you can see that we've got data on things ranging from active design and air quality, to falls among older adults, healthcare, the health impacts of air pollution, to transportation-related diseases, vector-borne disease, violence, worker health. There's an incredible range of data sets on the site. We have hundreds of data sets about all of these topics. So I'm going to pop into asthma. and show you around. When you click into a topic in the Data Explorer, you're offered a list of indicators, data sets, if you will, over here on the left-hand side, and one loads automatically, or you can choose others. We'll take a look. And then over here, you've got your data pane. And so you've got a summary table, which shows you data citywide, by borough, by neighborhoods. You can choose different geographies or different time periods here in the options here. And then you can also click through to these different views. So you can take a look at these data mapped. One of the things I like about this is that when you hover over one of the bars, it highlights the corresponding neighborhood and vice versa. So it helps kind of anchor those data points and give you a sense of what's going on. Again, you can change the measure, right? So this one has the estimated annual rate of asthma hospitalizations for people aged 5 to 17. You can also map the number, and you can change the geography and get different sort of neighborhood units here, as well as changing the time. So feel free to click around and explore this. We also, for many data sets, we've got trend data, right? For data sets where we've got historical data, we put that on the trend. We're usually sort of taking a step back from the neighborhood level and looking at things by borough to sort of stabilize these trend data a little bit. And then additionally, we've got this options over here called links. And this is where we link this data set to a sort of another potentially related data set. And we put these data sets on a scatter plot for you to explore. So here, I'm going to go to something similar. Actually, I'm going to go to asthma emergency department visits. And over here on the links, we can take a look at what's potentially connected. One of the interesting things about asthma in New York City is that we see a really significant correlation with homes with maintenance deficiencies. And so we're looking at, issues of housing and indoor air quality rather than outdoor air quality, displaying a real connection here. Some of the indicators have more links options than others. Some of them have this disparities options where we can look at the indicator by poverty level. The bottom line here is that when you start clicking around in the Data Explorer, you're going to notice lots of options and lots of ways to view this data set and to view things that may be connected. And I encourage you all to make use of it. A few things that I want to point out. We put a bunch of information about this topic over here on the left. And then we've got also some extra resources for you to make use of down here. You can download the data. You can click to our GitHub repository where the data are stored. You can even copy a little citation here. And of course, we've got information about the measures and about the data source for these data. So this is a very brief look at some of the asthma data. Like I said, you can explore lots of different data sets on lots of environmental health topics. I overheard someone mention lead poisoning. I saw someone mention lead poisoning in the chat. We've got a lot of lead testing and elevated blood lead level data on the data portal. Again, encourage you to explore that. So the Data Explorer is, like I mentioned, this is where we sort of put all of our data sets. But one of the things that we do with this website is we try and create a bunch of other types of data products that help explain what's going on with these environmental health topics. So over here, if you click into neighborhood reports, you'll see that there are reports, neighborhood-specific reports for these 5 different environmental health issues: asthma, active design, climate, housing, and outdoor air. So if I select housing and I choose my neighborhood, which is Flatbush, we get this housing and health neighborhood report for my neighborhood. And we get a curated list of indicators that are connected to this topic and a quick rundown on how this neighborhood is doing compared to other neighborhoods for these indicators. And so we can, get a little at-a-glance assessment of what's going on in this neighborhood. And we can also click into one of these indicators and get a little bit more depth on the data. So feel free to click and explore here. You can explore, other neighborhoods at a click or explore other reports at a click. These neighborhood reports are intended to provide a useful overview of some of these connected issues for any given neighborhood. We also have this section called Data Stories, and this is where we get a little bit deeper into some of our colleagues, our analysts' sort of thought processes and conclusions and interpretations and analysis of some of these issues. So these are write-ups of interesting environmental health topics. And these, we hope, provide a really accessible introduction into some of these topics. So here is one on how efforts to reduce air pollution should focus on neighborhoods with the worst health impacts rather than neighborhoods with the worst air quality. And so we're showing you that the neighborhoods with the worst air quality in New York City are not the same as the neighborhoods with the worst air quality related health effects. And so we use these data stories to look into interesting issues like this and provide what we hope are really easy to understand explanations of some things that you might not get just from digging in the data, right? We want to kind of expose our analysts' expertise and thinking and conclusions and interpretation and nuance for you all. So highly encourage you all to take a look through the data stories. We've got dozens on air quality and transportation and social justice, climate, housing, food and drink, and some others about how we work. As I mentioned, this site is all about showing connections. And so if you click over to this key topics section, you can get sort of all of the resources on the site about some of these overarching areas, including some other interesting custom interactives that we build. So I've clicked into the air quality key topic, and we can see all of the air quality data stories and the data sets and the data explorer and the neighborhood reports. And we've also have some interesting interactives here. So for example, I'll click into real-time air quality, and here we've got hourly data over the last 7 days from our real-time air quality monitors. You can actually, this is really cool, you can download 5 years of data from these real-time air quality monitors here. Feel free to go digging around in that. But in these key topics, we have a bunch of these other sort of interesting issue-focused interactives. Here's the heat vulnerability index, which is an index about what neighborhoods are sort of most vulnerable to heat and why, rather to the health effects of extreme heat. Our goal with this website is to help build bridges between our colleagues' expertise and analyses and you all, the users of the data. So we've also, we've worked really hard to make this very usable. Good search functionality, there's good tagging and keyword functionality that should help you find whatever you're looking for on this site. We also do a bunch of user testing. So if you're interested, you can sign up down here on the homepage. Every few months, we send a request for people to participate in some of our user testing. We also send some announcements when we add new material to the website. So we'd love to have you sign up. And for those of you who are just interested in getting right to the data, you can go to our GitHub repository and look through that. There's a link down here and get access to some of the underlying data. But that is my quick walk and talk through the Environment and Health Data Portal. Hope to see you sign up for our email list. Hope to see you make use of this tool. Hope to see you use these important environmental health data to make change, advocate for change, and improve health in New York City.
So hi, everybody. I'm going to close us out by talking a little bit about our COVID-19 surveillance data. So I wanted to start off just by talking about what disease surveillance are, or what disease surveillance data are. So these data include health information that have been systematically collected from a variety of sources, which are then analyzed and interpreted to inform our public health action. So if someone is diagnosed with a reportable disease or condition, New York City healthcare providers are required to send that information to the health department. And once we get those reports, we clean and standardize the information and use it to track diseases, inform our programs and policies, and prevent or respond to outbreaks. So some of you may be familiar with this page on our health department website. So this is where we've been posting our COVID-19 surveillance data since 2020. And the webpage has changed quite a bit since then, but it's still the place where you can turn to for the latest local information on COVID-19. So wanted to take a minute to just say first, the information that we post on COVID-19 does have some important distinctions from other communicable disease data that may be available through EpiQuery. So first off, we update our COVID-19 data more often. We're currently releasing data on Thursdays as compared to annually for some of our other communicable disease data. There is also a shorter amount of time between when we have received the data and when we post the data. So again, we're updating on Thursdays, but for those latest data points, there's usually only a 3-day lag. And then finally, the information we present changes as our systems change. And we do that so we can share information that will be useful and relevant to the current situation. And we also try to be very transparent when those changes are made so that everybody understands what we're showing and why we have made changes. And overall, our goals for sharing this information are to deliver a clear message on what is going on with COVID-19, to provide information for a variety of audiences, and to influence policy, prevent infection, and save lives. So coming back to our homepage, when you do land on this page, you can see we provide information on recent trends. That's under our latest tab. And this includes COVID-19 counts and rates of cases, hospitalizations, and deaths in the last week or in the last 90 days. And we also provide breakdowns by age group and race ethnicity. In our third tab for variants, we show information on the COVID-19 variants among our sequenced cases in New York City, as well as what proportion of cases have been sequenced each week. This is just to provide some context and information on which variants are currently circulating in New York City. And under the fourth tab, under trends and totals, this is where we give you the long-term COVID-19 case, hospitalization, and death trends, including data by zip code, as well as demographic group. And then just to highlight that second tab, we do still have information on this page for vaccinations, but right now, just to flag, this is historical data on COVID-19 vaccinations through September 15th of 2023, when mandated reporting for adult vaccinations stopped. This data comes from our citywide immunization registry, which collects vaccination data on adults and children throughout their lifetime. And the data we include here includes vaccination rates by demographic group, rates by zip code or modified zip code tabulation area, as well as trends by day. And so if you want to download or play with this data, we do make it available on our GitHub page. Again, it's updated every Thursday.
I see we have a question in the chat about can the data be broken down by age, and I say that some of it, as Matthew is describing, a lot of the measures in EpiQuery can be viewed by age. We're going to provide a couple of email addresses for you to contact us. I think that's on the next slide. Okay, you can email me at query@health.nyc.gov. You can email Matthew and at trackingportal@health.nyc.gov. I know that we can answer any questions like this if there's something specific you're looking for. So this is meant to be the summary here of the tools and data we just looked at, the websites, and yes, how to contact us. This is the City of New York job site. I looked yesterday, there are 485 health department jobs open right now. When you go to the jobs website, you click view all jobs, and then you can sort by agency first. I found that most helpful. And then you can see all the different jobs. You can sort by experience level, other factors, but you'll see all of those. You have great colleagues. And let's see, we also have internship experiences for students who are in undergraduate, graduate, or professional programs. They run in spring, fall, and summer. The next application period will open in the summer to work in like the fall semester of 2024. And this is a great program where you can get a lot of skills and experience on a really variety of health projects. The website for that is at the bottom here, nyc.gov/health/HRTP. Highly recommend that program as well. And that's the presentation. That's all we have. You have our emails, and really would love to hear from you, hear how you're using the data, and we'd love to help you with any questions you have.